Imagine being able to save someone's life with your own hand. It's a powerful feeling. In emergency situations, every second count and your action can save someone's life. So let's get started. How to save someone's life and how to perform CPR. Blood is like a fuel that runs our body, that's sustaining every functions. But what happens when we lose too much blood? Many people in our community suffer from bleeding and loss as a result of accident, violence, and medical conditions. Here are so many causes like accident, like injury during sport, cuts and wound during works. Friends, we all heard of terrifying incidents like road snatching, gun shooting, and violent crimes. These traumatic events can result in severe bleeding, organ damage, and even death. Medical emergencies like bleeding from eyes, nose, internal bleeding, traumatic events like car accident, physical assault, gunshot wound, stabbing, fall from height, or natural disasters. So, how can we save someone's life who is in danger? So, first we have to identify and respond to excessive bleeding. Look for sign of bleeding. Check for visible blood, wound or injury. Check for pale or cool skin. Sometimes bleeding is internal. Then check the breathing of the person. Rapid or weak pulse can indicate excessive bleeding. Call for emergency help or alert someone to call for help. While waiting for help to arrive, apply pressure to the wound using a clean cloth. Apply continuous pressure with both hands directly on the top of the bleeding wound. Push down as hard as you can. Hold pressure to stop bleeding. If the bleeding is not controlled by pressure, consider using a tourniquet. In emergency situation where a commercial tourniquet is not available, you can use everyday item to control severe bleeding like scarf, belt, tie. Wrap the material 2 to 3 inch above the wound. If the injured person is not breathing properly or normally, CPR should be given to them. Friends, CPR, cardiopulmonary resuscitation, is a life-threatening technique that involves two methods: chest compression and rescue breaths. First, to place the person on the flat surface. Then place the heel of one hand on the center of the person's chest. Place your other hand on the top of the first hand with your finger interlaced. Push down on the chest with the heel of your hand to a depth of 2 to 3 inches and count 100 to 120. Give rescue breaths. Pinch the person's nose shut and give one breath through their mouth for at least 2 seconds. Then give second breath. Continue the process until the ambulance arrives. Thanks for watching.